Hundreds of thousands of Arizonans will soon be limited in how much student loan money they can borrow. That's thanks to new rules implemented by the Trump administration's Big Beautiful Bill that go into effect today.
Those working in healthcare education fear what this could mean for Arizona, a state that's already struggling with a healthcare worker shortage. 13 News reporter Kayla Butter joins us live from the U of A's College of Medicine now. And Kayla, you spoke with some medical professors with the school today. What are they worried about?
Well, Mary, they say that limiting students' ability to borrow money in student loans could deter students from pursuing a degree in higher education, especially in the medical field, where multiple years of schooling are generally required. Now, those professors that I spoke with today said that could be dangerous, especially here in southern Arizona, where we're already seeing a healthcare worker shortage. New rules implemented July 1st through the Trump administration's Big Beautiful Bill will limit how much Americans can borrow and the repayment options. It's something that will impact hundreds of thousands of Arizonans, but specifically the state's healthcare industry.
Folks who are thinking about going into medical school or other schools that are professional are going to think twice if they have to go to private loans or other resources to pay for their schooling.
It's something Mari Ricker, a family and community medicine professor at the U of A, worries about, especially as Arizona faces a healthcare worker shortage.
We're going to have a shortage of 2,000 needed primary care physicians by the year 2030, so that's a really significant amount for the entire state. Even now, we're short at least 600 primary care physicians to currently care for the population.
Ricker says in her years as a medical professor, she knows how much medical students rely on loans.
The majority of the students do take on loans. It's, professional school is quite expensive, and it's been a part of sort of the culture of medical training for decades that we have loans available.
Erin McMahon, the director of the U of A's nurse midwifery program, says a healthcare worker shortage already has obvious effects, and they'll only get more apparent if the worker shortage gets worse.
Many Arizonans, even myself, can experience delays in scheduling appointments with providers or getting timely follow-up. So that's certainly going to impact our outcomes and just sort of general health for folks.
To limit these impacts to Arizonans, the U of A is working to get more medical school graduates into the field. They're increasing class size this upcoming school year and are introducing a new 3-year accelerated medical school program.
Medical school is usually 4 years, and all 4 years you're paying tuition. So by shortening it to 3 years, you get to pay less tuition.
The U of A is also offering more scholarships to medical students through that accelerated medical school program to further incentivize them to study in the field and to relieve some of the burden financially. Reporting live from the U of A's medical campus, Kayla Butter, 13 News.